because people are always like, well, why are you talking about Social Security when I'm talking about Medicare? And that is because think of Social Security as Medicare's secretary or as the gatekeeper. They're the ones that you have to go through to get in. And once you're in, your care is going to be handled by the Centers for Medicare and Medicaid Services, unless, of course, you go to Medicare Advantage, and then it's going to be by a managed care company.
Hey, y'all, this is Kosta. Whether you're buying groceries or shopping for a new car, in today's economy, we all want to get the most for our dollar. Unfortunately, shopping for Medicare and finding the most cost-effective options for insurance isn't always as straightforward. That's exactly where today's guest comes in. Debby Riskind, Director of Medicare Insurance Sales and Marketing at GM Goldman and Associates, helping seniors get the most out of Medicare. Welcome to the show, Debby. Tell us a bit about yourself and the work that you do.
Sure. So I work at my family business. It's GM Goldman and Associates. That's my dad. He founded it back in 1968. I work with my brother. And basically what we do, I've been with them since about 2009. I used to practice law. And then when I had kids, I went a different path. And what we do is we help boomers and seniors with all the different insurance solutions that they have to think about in or near retirement, with the bread and butter of our business being helping people navigate Medicare.
Incredible. So we're going to take some rapid fire questions to sort of to speak on the complexities of Medicare and hopefully answer a lot of the pressing questions that people have early in this video, and then we'll get to the nitty-gritty, essentially. Okay, are you ready?
I'm ready.
Okay, question 1. Do you have to take Medicare at 65 if you are still working?
So that is probably the top question I get. We get calls all day long on this. The answer is yes or no. Okay. It depends on your specific facts. So if you are still working and you work at a company that has 20 or more employees, then the Age Discrimination Act governs here, and you get to keep your insurance as the primary insurer. So in other words, they have to offer the exact same insurance that they do the younger employees. If you're at a company with a group plan and it's less than 20 employees, then you do need to take Medicare, because then you don't have a primary insurer. That means that if you had a bill, Medicare would come in and pay, you'd only have 20% covered by your plan, and you wouldn't have that 80% covered. So the bottom line, though, whenever anyone asks me that question, the one thing I say to them is check with your HR. So I'm giving you the general rule. Even when it's a client and I'm getting more specific, you always want to confirm what you think you know about your plan with your company.
So let's say that you're planning on signing up for Medicare. How and when do you sign up?
Okay, so that is a loaded question because there's so many different ways to answer that, right? So first of all, if you are somebody and you're taking your Social Security and you're taking it 6 months prior to your 65th birth month, then you're automatically going to be signed up. Okay, so that is a trigger for the Social Security Administration to send you a card effective the first of the month of your birth month. If you are not taking your Social Security, then it is on you to sign up. And you can start about 3 months before. You could do it online. You could do it by phone. In other words, calling the Social Security Administration, setting up an appointment. Or you could set up an appointment and go into the local office. But here's the thing I always like to point out, because people are always like, well, why are you talking about Social Security when I'm talking about Medicare? Mm-hmm. And that is because think of Social Security as Medicare's secretary or as the gatekeeper. They're the ones that you have to go through to get in. And once you're in, your care is going to be handled by the Centers for Medicare and Medicaid Services, unless, of course, you go to Medicare Advantage, and then it's going to be by a managed care company.
And we are going to talk about Medicare Advantage and Medicare Supplement. But before we do, what are the costs of Medicare?
So it's really interesting because a lot of people, when they get to Medicare, they're thinking that it's free. They think that because they've watched a FICA tax come out of their paycheck every 2 weeks, that by the time they're retiring and on Medicare, that they're done. But unfortunately, it doesn't work that way. So It's going to depend on which path you go, but let me give you some generals first that apply to everybody. First of all, to qualify for Medicare, you have to have 40 work credits. That's like approximately 10 years of work. But it can be based on your spouse if you're the spouse that didn't work, okay? But bottom line is that earns you Part A, which is hospital, as a 0 monthly premium. Now, there's some people that could have less than the 40 credits, and they can pay for part of Part A. But for most people that I talk to, Part A costs them nothing. Now,
okay, so that's inpatient, right?
You got it. Exactly.
Right.
So everything at the hospital. Part B is everything medical. So that is your doctors, your surgeries, it could be labs, etc. The list goes on. With that, just like the insurance you're in now, you're paying a monthly premium. In 2022, the standard premium is $170.10. But there's something called an IRMA adjustment, income-related monthly adjusted amount. I think I'm saying that right. And if you're higher earners when you're in your 60s and on Medicare, then you're going to pay more than the average $170.10. And by the way, for 2023, that $170.10 is actually going down. There was a big uproar. There was a big increase in 2022 because of an Alzheimer's drug. But then they realized it was too much of an increase, and it's going to go down. I think it's 164, and some change. But the bottom line is that, so everybody, whether you go original Medicare or you go Medicare Advantage, you're going to pay that Part B premium. Okay?
So
now, go ahead.
Is there a cap on how much you can pay in for that Medicare premium?
Well, there's not a cap for the premium. The premium is a set amount monthly. So think of it this way. That's your constant. You're going to pay that Part B premium. That allows you access to Medicare by paying that. But once you're in Medicare, Medicare is not designed to cover every dollar. So there's gaps. So we have to kind of break it down. Let's talk first about original Medicare. If you go original Medicare, okay, and let's say you have a doctor bill, and I always use this example in all my videos, and let's say you have a $1,000 MRI, and I know they cost more than that, but it's easy to do the math. So you have a $1,000 MRI, and the doctor in original Medicare has, submitted the claim to the Centers for Medicare and Medicaid Services. They approve the claim. Let's say it was medically necessary. That's the standard. But they're responsible for 80%. So there's that 80%. They pay the $800. What happens to the $200? Now, you could pay it yourself, right? Not get a supplement. Or you could get a Medicare supplement policy, which is, of course, what I would recommend, because that 20% that is not covered by Medicare is uncapped. So in other words, if you had a $1,000 bill, you'd pay 20%. If you had $1 million bill, you'd pay 20%.
Wow,
So,
I didn't know that.
yeah, it's uncapped, and that's why, you want to get a Medicare supplement policy. There's other gaps. There's deductibles, but that's the biggest reason of all because of that number. Now, go ahead.
Well, I was going to say at the end, we're going to talk about Part D, and I'm sure there's costs associated to that as well. I don't know if you want to touch on those briefly.
Well, for sure. Going into D before we even shift over to cost of Medicare Advantage is that you would pay a monthly premium, and then with that monthly premium, you're going to have copays. So in explaining it, I don't know. Let me give you a little bit more about Advantage, and then we could get into detail with D because I could go on forever about that. So here's big overview, right? When it comes to Medicare Advantage, what happens is you eliminate your Medicare supplement premium, you eliminate your Part D premium, so you have a low or no monthly premium, but you have what's called a MOOP, a max out of pocket that you could spend. So every time you go to the doctor, you have some sort of a service, you're going to have a copay or coinsurance up to a max that you could spend. So there's two different systems. Think of it this way. Pay up front, pay these monthly premiums, whether you go to the doctor or you do not, or pay as you go.
Incredible. Real quick, if you have a pre-existing condition, does that matter in terms of qualifying for Medicare?
So in the beginning, does not matter at all. When you come new to Medicare, you can go to any supplement you want in the first 6 months that you start Part B, if you get a Medicare supplement, when it comes to Medicare Advantage, there are never qualifying health questions. But this is a really important question that you asked me, because here's the deal. When you first start with Medicare Part B, you do have that 6-month window where you go to any supplement company if you're going to stick with original Medicare, right? They can't ask you any questions. But now let's say it's 2 years later and you want to switch plans, switch Medicare supplement plans. Then they can ask you qualifying health questions. So why is that so significant? You're going to get increases with your supplement, and sometimes you want to shop at the premium. But here's the other thing I want you to know. If you go Medicare Advantage, right, and you go to that system, and now it's 3 years down the line, and you're like, I want to get back to original Medicare. You could get into original Medicare, but you may not be able to get a Medicare supplement if you have health issues. It's going to depend on your state. It's going to depend on the health issues.
So you'd be on the hook for that 20% premium if you don't have a supplement plan, and that's a risk that most people shouldn't take, right?
Right. So if just to give an example, if I had somebody call me and they're like, I want to go back to original Medicare, but that person has cancer, right? And they're trying to get back in, and it's been a couple of years. They're outside of the free look period where you can try Medicare Advantage. They probably cannot, it depends on the state, but they probably cannot get a supplement. And then I would have to say to them, stay in that Advantage plan, because then you have that max out of pocket that you can spend. It's defined by the plan.
So you've spoken both on supplement and Medicare Advantage. Mm-hmm. What do you recommend to most people, and how do you make that determination? Okay,
so great question. And the thing is, everybody wishes I could just give that exact answer. What would I recommend everybody? And guess what?
Right.
Here's the deal. You want to work with somebody, an agent, who specializes in both original Medicare with supplements and Advantage, because then when you're sitting with that person, you figure out what is the best fit for them. Now, there's obviously a simplicity to original Medicare, because there's no prior approval needed for claims, there's no doctor networks, but you're paying that premium, and that can get expensive for people. So there's reasons I like both systems for different people, and again, really is going to depend on their situation.
And correct me if I'm wrong, but like Medicare Advantage, they have benefits that the traditional Medicare plan does not have, right? So like, for example, I think they offer like gym memberships. In some instances, I believe they even offer a small stipend for in-home care. I think they started that in 2020 or 2019, I believe. But like overall, is it a better value? I guess just so people understand. I know that you got to kind of meet people where they are, but in your opinion, when you're working with clients, for the majority of the time, do you say, why don't you just start with regular Medicare and then transition to Advantage if you don't like it, and then you can come back within that free look period?
Okay, so that was a long question. Let me think how to answer that.
Sorry.
So here's the deal. Here's the deal. They're both, okay, when you see the commercials, obviously right now everybody's being I almost forgot the question, so I got to go back. When you see those commercials, right, and you're seeing all these great perks. Perks are great, and this is what I always say to people. When we're looking at and I'll get back to the value of it, but when you're looking at a Medicare Advantage plan, the first place you have to start is, are your doctors in network, and are your drugs cost effective under the plan? Once we determine that, that's when we celebrate the perks. All the different carriers can offer different kind of perks. Some carriers offer incredible dental coverage. Others are going to offer over-the-counter benefits for your Advil and your different. Some are going to have a flex card. Some have a return on your Part B premium. I mean, the list goes on. And with every carrier where they give, they take. So meaning one carrier may give this, but then less on dental. And another carrier may put more emphasis on a different perk. And they all seem to offer gyms, okay? So you're asking, is the overall value? Yeah, listen, if your care went smoothly and you weren't denied prior authorization for something that you needed for your health care, what could possibly be wrong with having these perks, right? They're
Sure.
great. The issue is just that now you've gone to managed care. So
And
it's
so,
not just your doctors. Go ahead.
well, what is managed care, if you could explain to the audience?
So, sure. I'm going to give it my best shot with that. So think of it now. You're a young guy. You're not on Medicare. You have an insurance policy, and if your doctor said you needed surgery or you needed an MRI, somebody's got to approve it first. It's not just your doctor saying thumbs up. In original Medicare, the system. It's not managed care. The doctor has to show it's medically necessary, but so it's really very similar to what you have, what most people are coming off of, those kind of plans. So it's almost like a gift in original Medicare. There's those steps that aren't required, right? You know you're going to get that care. Now, there's been some controversy over, the managed care prior approval, that it's not exactly standardized, because really think about it. You have all these different companies offering managed care, and so they're applying their own standard. Technically, it should be the same care that you get through original Medicare. And I don't think any companies are out there trying to hurt anybody. They just need to figure out Medicare, some sort of standard that has to be used for all the companies.
You know what and I was going to say that I think that when you are on private insurance through, the 5 major insurance companies, whether it's through your employer or privately, realistically, you're not going to use your insurance that often. Obviously, if a catastrophic occurrence may happen. But when you're on Medicare, you're over the age of 65. If you're on Medicare Advantage, the process of managing that population subset is there's probably a lot of unknowns. And that system, that Medicare Advantage system, is being tapped all the time. Do you think that in a lot of ways, and I know this is kind of like a technical question, and you don't work for CMS, I understand that.
Yeah, so I may not be able to answer, but give me a shot.
Do you think that it's going to take a lot more time for Medicare Advantage to figure out how to create that standard of practice, that standardized approval process? I
mean, here's the deal. There was a report by the Office of the Inspector General this year that put a lot of focus on the fact that there were claims that would have been approved in original Medicare that were not approved with Medicare Advantage that then were appealed, right? And so there's been a lot more of a spotlight on it. And so hopefully, yes. Listen, it's getting closer to 50-50 between people in original Medicare versus Medicare Advantage. Original is a little bit bigger in the statistics, but there's a lot of happy people in Medicare Advantage. And I have some people that, money is no object clients, and they're still choosing Medicare Advantage, and it's worked very well for them. So, you're going to hear a lot more noise from the people that have had a bad result or something that they didn't, that it didn't go their way, and understandably. So I don't know how to answer that, except for that I think yes with time, because the system is moving towards that, right? And it's got to work. People need their health care. And like I said, I don't think anyone's out there trying to hurt somebody. It's just there's a lot of different companies, and it does need to be similarly.
And there's right. And there's a lot of people who are on Medicare, and that number is growing exponentially every single year. So absolutely right. The sense of urgency is definitely there, I think is what you're trying to say. Yeah.
Well, I think it's important. People got one life to live, and when their health's at issue, they need that care. It can't be resolved in 3 years. It's got to be resolved now.
Right.
So, yes.
Exactly.
Yes.
Let's talk about Part D. What is Part D, and do you need Part D if you're not taking any prescriptions?
Okay, so Part D is your drug coverage. Not to be confused with drug coverage under Part B. There's different categories. So you're going to think of D, as what you're getting at the Walgreens or at CVS, your pharmacy, right? The prescriptions you pick up. B is going to be more like the medications administered at a facility. Someone needs chemotherapy or different kind of medications through, an IV. That's under B. So D, again, are those drugs. And here's the interesting thing. They did not offer Part D until 2006. So if Medicare was first, I like laws. I'm an attorney, so I like all the rules, even if it comes a little nerdy in the interview. But so Medicare first came to be in 1965. Okay, and when it first started, by the way, I want to explain this because this, to me, puts the bright light on for everybody, the understanding. 1965, it comes Medicare, and it's just A and B. That's why it's called original Medicare, right? You got Part A, hospitalization, B, and doctors. And your only option was that system. Medicare Advantage wasn't offered. Legislation wasn't passed until the late 1990s, and it's slowly been evolving, right? So you have original Medicare, and then you have Medicare paying these managed care to manage Medicare beneficiaries' coverage as an alternative, right? So that's the framework. So when you talk about D didn't get offered till about 2006. It's continuously evolving. There's been some recent legislation that's slowly going to be implemented over the next couple of years, which will be good to lower people's costs. But so that's my tangent. But here's my thing to you. 100%, if you are, whether you take drugs or you do not, you want to sign up for D because A, there'll be penalties if you come in later. So it's the penalty is for every month that you did not take it, that you're eligible, it's 1% of the national average. So if the national average premium is $34, 1% of that, and for every month stacked on top of each other. And in the premium, it doesn't sound like a big number, but it can add up, and it never goes away. So that's reason number one. Reason number two is that we don't know what's happening 5 minutes from now, right? So you could be perfectly healthy and not get a plan, and then 6 months later, let's talk about your neighbor. Your neighbor gets Parkinson's, and it's June, and he's not in a plan. He cannot jump into a plan mid-year. You have to do it during the election period, so he would be stuck paying those expensive meds out of his pocket till he could get in a plan next year, plus he'd have penalties. So I'd say you find a low-dollar plan at a minimum, even if you're not taking. And by the way, Part D gets built into Medicare Advantage plans. So you still would have it even if you went Medicare Advantage.
How hard is it to navigate Medicare if you don't work with an agent? And do you recommend that everybody actually does work with an agent?
Well, of course no, I'm just kidding. So here's the thing. I think once you're in it, you're okay. Right? But it's all the, it's like the two forks in the road. Which way are you going? Right? Is that so you go one way, you go the other. And do you have to sign up and do you have to take it? And what are your costs going to be? My clients who are 80, they're still working with me. I mean, we're not like a one and done. We help you and then we help you every year. So there's things to explore every year. Like, are you in the right drug plan? Do you want to switch between the systems? Is your supplement premium so high and you're healthy, can you get lower? So full circle to answer, in the beginning, I think you definitely need an agent. And even as the years go on, if you're lucky enough to find an agent that sticks with you and always is there to help you, why wouldn't you want that help? You don't pay an agent anything. Agents, we earn commissions. You pay the same premium, whether you go directly to the insurance company or with an agent. So I always say, get yourself an advocate. Get someone who knows their stuff that's going to look out for you and, help maintain your costs in retirement.
Absolutely. And if we could just go back to talk a little bit more about Part D, there's something that popped into my head as you were talking. Can you speak on what is the donut hole that a lot of people encounter under Medicare?
Sure. I'm going to do my best. So here's the deal. First, I want to say this before I answer what is the donut hole, okay? When you're looking at your Part D, you want to look at the overall big picture, what's it going to cost you, right? So people get fixated on the deductible, the donut hole, all that stuff. But bottom line is when you're choosing a plan, if there's a plan that you're going to spend $500 for the year versus a plan that you're going to spend $2,000, we know you're going to want to go for the one that's going to cover your drugs at $500. So here's what happens. There's 4 phases, okay? And there is the deductible phase. Not every plan has a deductible, but those plans typically have a higher premium than. You have a initial coverage, I think I'm calling it the right thing, and then you have the quote-unquote donut hole. It's not really called that anymore, and then the catastrophic coverage. So what happens is that with the donut hole, there's this period of time where your prices may go up or they may go down because you've fallen into the 3rd stage of drug coverage. But again, I say you focus more on the big picture, and I can show clients what it's going to cost each month, but you don't really focus on it. You want to understand what it is, but you really want to know with your pocketbook, how are you doing this the most cost-effective way, if that makes sense.
No, it does. And believe me, you are unpacking a lot of very complicated terms and putting them into kind of layman's terms. Right. So I do appreciate that. Sure. Medicare is complicated, and I think it speaks to why everybody should work with an agent so that they make the right decisions on their behalf. Last question. What is Medicare AEP?
Okay, so the Medicare AEP, and this is funny to me, there's so many different abbreviations, right?
Right.
I think the Medicare AEP is the annual election period, but then you sometimes hear it called the annual, all different words that I hear, but it is basically the time of year where existing Medicare beneficiaries, so when you're in Medicare, you're called a Medicare beneficiary, okay? Though it's for people already in Medicare to make changes for the next calendar year. It runs from October 15th to December 7th. So if I have a client who is not on Medicare yet, the AEP doesn't impact them. They're going to have what's called an initial enrollment period or a special enrollment period, an SEP, or a general enrollment period. That's their own individual timing. The AEP is for everybody else. So think of it this way. Right now, you probably have insurance, right? And there's a time of year where you're evaluating for the next calendar year what you're going to do. Are you going to keep the coverage? Are you going to switch it? Same thing with Medicare, which is, like I said, a reason why you want to have an agent that sticks with you, because you can revisit different topics every year. And then it becomes effective January 1st.
What are some, and if you could give us some examples about what type of changes you and your clients discuss, just so that, listeners can kind of know, oh, okay, well, I'm going through that, and maybe I should call an agent and talk to them about X, Y, and Z.
Absolutely. So there's multiple things that you could be thinking about during the AEP. So you break it down first. Let's say you have someone in original Medicare. So that means that they have a supplement and they have a Part D plan. The Part D plan, that is the time of year where you must look at it to switch for the next calendar year if you want to. Now, not everybody has to do a review. You're going to receive from your carrier a document called a Notice of Changes, and it will tell you how your plan is changing for the next year. But I will tell you this, if you're somebody that has added new meds, you definitely want to do a review, because what if that drug could be more cost effective with another plan? Or if you learned your premiums doubling, something like that, you want to look to see are there better options. When it comes to Medicare supplement policies, you actually can change that any time of year. That's private insurance, so you don't have to do it within the AEP, although a lot of people think they do. But really, you change that by qualifying with your health. If you're in original Medicare with a supplement, that's a time where you can switch into Medicare Advantage for a January 1 start date. If you're in Medicare Advantage, that's the time you could switch to another Medicare Advantage plan. Or it's a time of year where you could say, hey, I'm done with this. I want to go back to original Medicare, but you got to make sure that you can get a supplement, and you would have to apply for a Part D plan. And again, remember, October 15th to December 7th, all for a January 1 effective date.
What do you think are the most common mistakes that people make regarding Medicare?
the most common mistake that you don't want to see someone is to miss their enrollment period, where they can initially start, because they can end up with penalties. So if you don't sign up for B timely and you think you're keeping your insurance, for every 12-month period that you don't take B when you should have, the medical Part B, there's a 10% penalty that stays with you forever. I already mentioned the Part D penalty.
Right.
So that's another big one. And then just understanding what we had talked about earlier, that like if you start in Medicare, and let's say you already have a lot of health issues and you go right to Medicare Advantage, chances are you'll never be able to get a supplement. So you want to really think that through.
What do you think are the most important factors when you're navigating Medicare, and more importantly, enrollment into Medicare?
So when you say the most important factors, so let me think about what you're asking me with that, because, the bottom line is this. It kind of goes back to what I answered a minute ago, in that your timing, okay?
Yeah.
Understanding, like, first of all, do you have to take it? If you're working at Kraft and you are at a company with thousands and thousands of employees, you can stay in your group plan, right? Because if you turn on B, that's like paying twice. You're paying for your group plan and you're paying for Part B. So that's something that you want to make sure you're real clear on. You want to make sure that if you're staying in Original Medicare, you're going to get that supplement too. A lot of people think that when they sign up for A and B, they're done. You're not done. Now you got to figure out which path you're going. Are you, and how are you protecting yourself? So I don't know if that answered your question.
No, I think we both agree, and I think people that are going to be watching this podcast are going to agree that timing and making sure that as you approach the age of 65, you get educated. You either start, reading the guidance on CMS's website, or you talk to an agent about Medicare planning.
Yes.
And so I guess that kind of leads me to my next question. Are there any insider secrets that you feel more people should be aware of when it comes specifically to Medicare planning?
I try to share. To me, they no longer feel like secrets, because I go on TikTok, right? And I'm trying to teach all the time, because I'm trying to share what I think are the important things that somebody needs to understand. And one of the biggest things that I always say, I've posted this a couple of times, is don't scroll by. Start learning now. Start getting comfortable with the conversation so that you understand the kind of questions you need to ask. So you understand that there are deadlines, that there are ways that you can mess up if you don't follow the timeline. So for me, there's no secrets, right? I'm here trying to be an open book and teach people and help them. So, but again, you're hitting it exactly right. It is about being on top of it, the timing, and getting comfortable with it and learning. So, it's interesting. It's that's why I went on TikTok, because, I have a 21-year-old daughter that was on TikTok, and I was like, what are you doing on there? I want to see. So that's when I decided, well, why not take my message there? And go ahead.
Well, I was going to say, how did you come up with, because you have to, obviously you agree, Medicare is 65 plus.
Yep.
It's for,
unless they're on disability, right?
True. Yes, that's a good point. But it's for the baby boomer generation, people born between 46 and 64. The average age of people that are on TikTok are people in their 20s, or in their teens.
Well, so you
take a message that's meant for the 65 plus generation, and you put it on a platform like TikTok, and honestly, you have great success with it. How'd you decide to do something like that?
Well, so first thing, Kosta, I want to clear up, okay, is that, first of all, because of my daughter, I started watching, and then I'm like, that might be fun, and I could share my message, because my brother and I were teaching seminars and webinars, but people like information in small bits like that, so it's a great platform. But, the bottom line is this. I want to tell you, one of the biggest things I've learned through my work is that people in their 60s are actually a lot younger than you realize if they're healthy, and they're hip. They're on TikTok. So, maybe a bigger percentage of the people are younger, but sometimes I have people reach out to me for their parents. But honestly, you'd be amazed at how many older people are on TikTok and are seeking the same kind of information that the younger people are on there dancing for. You know what I mean?
Sure.
It's like, it's become a wealth of information. There's so much you can learn. And so I don't know, it just worked. And so, it's sometimes, I was doing it so much for a while that I took a little bit of a step. I felt like I was a teenager, always on my phone doing videos. But I really do love doing it because I feel like if I'm giving someone that 2-minute thing, they slow down, they think about it. People reach out to me. I have people across the country, because of that platform. I'm helping people. I have clients all over.
I think the biggest point, aside from obviously timing, that people run into, and I know this from my own personal experience when my father-in-law was going through the Medicare process, turning 65, collecting Social Security, all that stuff. It's not free. Everybody thinks that Medicare is free. Yeah. It's not, right?
Well, I'm telling you, jaw-dropping to people. They're angry, and I'm like, you've never, this is more in response to videos. Oh, well,
of course.
You've never had insurance. It's free, but it's a good deal. You're going to have excellent coverage, but go ahead.
Yeah, and it's accepted at pretty much everywhere. Yeah. Every doctor will 95% of doctors and 100% of hospitals are going to take Medicare.
Yeah, I mean, think about it. You hear in the newspapers the statistics that, what do they say, 10,000 boomers a day are turning 65.
Yeah.
Most medical facilities and doctors cannot afford to ignore that population. So
Absolutely.
You're right. And the fact is that people, once they're on Medicare, I think Medicare is like a scary word to them because it makes them feel old or it makes them feel like they don't understand it. But most people, once they're on it, they're really happy. They see they have very good coverage. They're getting the care they needed. Yes, there's an expense to it, but, that's the deal.
And so before we wrap up, I do want to say one thing, and then I want to ask another question about Medicare plans and supplements. First thing is, I want the audience to know that Medicare does not pay for long-term care.
Yes.
They will pay for the first 120 days if it's medically necessary in a facility, like for rehab and things like that.
Yes.
But they will not pay for you to receive non-medical home health care services like help with baths and, and laundry and errands and companionship. That is only paid if you're looking for a government resource and you don't have long-term care insurance. That is Medicaid, which is another video for another time.
Yeah. Yes. Yeah. So if you look at the Medicare and You book, you're going to see there's a list of what Medicare does not cover, and there's in bold print, Medicare does not cover long-term care. Now, you referred to skilled nursing facility care. That's under Part A of Medicare. They will cover up to 100 days. But people have to understand, that's okay. People have to understand that that's not your plan for long-term care. And that doesn't even mean that if you needed to be in a facility that you would have access to it. You have to have a 3-day hospital stay to qualify, and you have to need skilled care. And you probably do a better job of explaining the difference between custodial care and skilled care. But skilled care, you're going to think about, let's say your neighbor fell, had a hip replacement, and had a 3-day hospital stay and now needed to be in a facility.
To receive like physical therapy and stuff.
And too hard to be in the home. And even with the 100 days, you're not guaranteed the 100 days. So what I always tell people is that is the biggest gap people are leaving in their retirement planning because if you need that kind of custodial care, help with 2 out of 6 activities of daily living, that is not Medicare's job. Unfortunately, but it's not.
Yeah, for sure. And I run into that all the time, being in the long-term care space. Obviously we do a lot of non-medical home health care, the custodial care that you're describing. And the same conversations that you have with individuals who are looking, that are going to be receiving Medicare or going through Medicare planning, I talk about it on the Medicaid side.
Sorry. Yeah.
No, you're fine. You're fine. I talk about it on the Medicaid side.
Sorry.
So I want to ask, Are there any specific Medicare plans or supplements that you feel like people should avoid?
Unrelated to long-term care now. You're just
Correct.
saying in general?
Yeah, just in general, yeah.
I mean, no.
Like, are there any bad eggs out there that you are like, don't do that?
Well, I'm not sure I'm going to answer that in a video, but there are definitely, here's the thing. We're independent and we contract with multiple carriers. And when we're choosing to work with a carrier, it's because we feel good about that carrier. When we don't contract with the carrier doesn't mean necessarily that we think they're bad. It's just sometimes there's only so much you can take on, right? So is there any, there could be a company that I'd be like, hey, great with the drug plan, but I wouldn't put them in Medicare Advantage. Or, there's different reasons, but I don't want to throw a name out there because it's
Sure.
not because of the company, but because every state there's different states, there's different circumstances. So honestly, no, it's more about which is the better path for someone. And then once we determine that, we figure out which is going to be the best carrier based on that person's needs. With the supplement, it comes down to price. One thing you want to know about Medicare supplement plans, let's say there's 100 companies offering Plan G. They're standardized by law. So in other words, that means that G is handled the same benefits no matter which carrier you're with. So when I'm looking at a carrier and one is charging $170 for the premium and one's charging $140 and they're both really good carriers, why wouldn't you pay $140 a month premium instead of the $170? Does that make sense?
It does. Does that span across states as well?
As far as standardized, yeah, the standardized by law is federal. It's the OBRA
Okay.
Act. It was passed in the 1990s. And basically, I made a video, G is G is G. And here's the logic, because that doesn't make a lot of sense what I just said. But if you had a bill, right, let's go back to that $1,000 MRI. Original Medicare processes it, they pay $800. No matter which insurance company with Plan G they're all paying the same $200. Because it's 20%, and they all have the same responsibility, assuming you choose a plan that's covering the 20%, to pay the $200. So, but with Advantage, they're all different. And that's why you want to find someone that if you're looking at Advantage, you want them to ask for your doctors and their addresses and their drugs, your zip code. And then you figure out what fits you.
This has been such a fascinating, interesting, and I think important conversation. So we always like to end the show with a call to action.
Okay.
What's your best advice for someone entering the long-term care industry as a patient, a caregiver, or an industry professional?
Okay. Well, to me, anybody who is aging and thinking about their big picture when they're older is to at least explore the topic of long-term care. Because long-term care, I get a lot of comments, sometimes it's not affordable, it's not, but the reality is you need to understand what is going to be covered through Medicare and what is not, and where the gaps are in your retirement. So explore it. Understand that there's options out there, ways to plan, ways to think about what if that, God forbid, did enter your life? What would you do? How would you pay for that care? So knowing that Medicare is not going to do it for you, are you going to go to your savings? Are you going to take out traditional long-term care or some sort of hybrid product that's a life insurance product? So you just need to educate yourself. Just like what we're doing right here. The purpose right now, us talking, is for people to start thinking, to start connecting to that big picture. Long-term care is no different. You need to understand how it's going to fit into your retirement. And it's like your checklist. Either maybe it's something you're going to pursue or it's not, but at least your eyes are open, right? To understanding the impact of having it or not having it.
Debbie, thank you so much for being
Welcome.
here and
Thanks for
speaking
having
to
me.
us.
Sure.
I think that we covered a lot, and I'll be honest, I've talked about Medicare before, and I am so glad that I finally have an expert that can
Absolutely.
sort of demystify and unpack this program for us. So thank you very much for being here.
Thanks for having me.